striated step on the front and a elongated step on the back. So
Meaning that he puts like this.
it's like he's walking on clouds on the back and like he's walking very stiff on the front legs. So see if we can see that. Do you see that at all?
Just sure to seem that the forefeet take a longer stride than the hind ones.
Okay, you want... Alright, so basically what you're looking for here is it's really important to notice if you have a muscle change. So you want to look at, because whenever you have a neurological deficit, a defect in the nerves, basically you're going to lose that muscle mass very quickly. So go ahead and look at his face. He's such a good boy. And then, so you just want to make sure that he's able to move his facial, he has facial expressions. It's not like one side is just hanging down, or that he's missing half the muscle on his head here. So that's really important. You can also look at his tongue and make sure that the muscles are also symmetrical on both sides. So that's part of your cranial nerve exam. You're a good boy. And then what you want to do is take a finger. And don't take your whole hand because sometimes that pushes air. You want to just take a finger and make sure he blinks, and that's just to check that he's seeing okay. You can also take a cotton ball and drop something. Or, well, yeah, a treat makes a sound, unfortunately, so they can kind of follow it by listening sometimes. We can try that with Nana with treats since he's deaf. But anyway, and then you want to make sure that he can feel on this side and this side. So you just kind of tap both and make sure that he can blink. Usually you can take a Q-tip or just kind of make sure that he is feeling inside both of his ears. Same for the nose. I know, I'm super rude.
So, but for instance, when you touch the ears and the nose, you look if he's blinking or he's sort of like pushing away, if he's reacting at all. Or...
Yeah, exactly. If he wasn't reacting, then it would be a cranial nerve deficit. So that's how I always start my exam. So basically you walk them back and forth, and then you check your cranial nerves. He's completely normal. Also make sure to give them some food because that's your hypoglossal nerve. So that's working okay. So then the next thing you want to do is check for neck pain, especially if you have a dog with a big head. Then you want to check for neck pain. So basically you have to, not meanly, but go ahead and move his neck. A normal dog should be able to touch his nose on both sides. Oh, baby, I'm sorry. Here. So he had a little bit of pain there on the right. Sometimes it's hard because sometimes they just don't like what you're doing.
And sometimes you can do it with a treat and they can follow as well.
We can try that. You want to follow? Want to follow? Yeah, I don't want to hurt you again, baby bug. So he might have some little discomfort there. So, anyway, so that's kind of checking your back, or your neck, your neck muscles. And then what I like to do after that is go ahead and go into proprioception. Proprioception is the ability to see where you are or to know where your foot is without looking. Like I know my hands are like this and now I know that they're like that. So when a dog gets the first, since on the outer portion of the spinal cord is usually the first thing to go. So I go ahead and flip their foot over. You really shouldn't be looking, but, and then make sure that you can put it back. Good boy. Sometimes what you need to do, especially with the bigger dogs, is kind of support them in case they have, if they're weak or they have something else going on. Because I'm not really testing weakness. I want to, differentiate between being weak and not being able to flip over and just not knowing where your foot is. So that's not normal, Mr. Sausage. So, and then you do the same other side. Support his weight because it's not about whether or not he's weak. It's about knowing where his feet are. He's a little bit better on this side. And, this one is a bit difficult, I feel like, sometimes because sometimes some dogs will let you put their foot there. Like some dogs are so well trained that if you put their foot there, they hold it. And that doesn't mean he has a defect, it just means he's really well trained. So you kind of, you know, if you see something abnormal, do it over and over again, just to make sure it wasn't a fluke and that he really doesn't really know where his feet are. Okay, so then what you want to do, this is hard on big dogs, you really want them to walk forward.
Wheelbarrowing?
Yeah. And of course Sausage doesn't want to walk forward even with 4 feet, so it's hard. Yeah, it's hard. And this is also hard on big dogs. You put them down, can he place his feet?
And that signs that he
knows, you know, when the ground's coming and he knows where to put his feet to get on the ground.
Yeah.
So you kind of lift them up. Whee! Yeah, you're such a good boy. You're such a good boy.
He didn't know that he'd be like...
Yeah, he wouldn't really know. He did it better than I thought for his proprioceptive stuff. His loss here on the back, right? So, okay. So then what you want to do, or the next thing I do, you can develop your own system, of course, is I go ahead and press down, just all the way. And here I'm just looking for pain. So that wasn't super comfortable for the bug. He's not super comfortable anyway. Can you stand up for me, my little love? So. And I just press down all the way. Again, you don't always know what exactly happened, like if it's traumatic, he could always have a fracture, that kind of thing.
Yeah, but when you look for a pain response, or?
Yes, exactly. So, yeah, I'm not trying to be mean. Unfortunately, neuro exams can be a bit mean if there's something else going on. Like you saw with the neck, you know. I'm not trying to, but... So here, you pinch all the way up. So here we have a really good response. So you pinch all the way up on their back. Just keep going. And there. So usually then it's 2 vertebral bodies ahead. So the lesion is usually 2 vertebral bodies ahead of where the reflex comes back. So we're looking in this area based on that.
Yeah, but for instance, this was now that he had a response here, that was more abnormal. But if you pinched here, you didn't get anything. That was
I'm
good.
sorry, this is abnormal. So here, he should have had a response the entire time. I'm sorry, I didn't explain it correctly. And see, it starts kind of here a little bit, and here it's completely there. And so what's normal is how he responds here. That's normal, what he's doing here. Here, he should be feeling that, and he should have a muscle twitch, and it's just gone. So it means that there's a lesion in his spinal cord about here, I would say, which also fits. So basically, whenever you have a lesion, wherever the lesion is, you'll have what's called a lower motor neuron signs. So if it's right here, then he should have lower motor neuron in his legs, depending on if it's really like thoracic or cervical, it's right on the cusp. And he should have upper motor neuron signs in his back leg. Do you remember what upper motor neuron signs are?
I know that there are, but you can remind me. No, really, I've done this, but so just...
So the first thing you want to do with upper motor neuron signs, they should have really stiff muscles. So if he has a lesion here, then he's going to have upper motor neuron on the back legs, right? Do you remember that?
No.
Okay. So wherever the lesion is, you're basically directly affecting the limbs going down here, and then whenever the lesion is, more cranial, I'm never good at explaining this, more cranial, then you're going to have less of a, the talking pathway is gone. The reflexes are still intact because the reflexes are one system here, but the talking with the brain is gone a little bit. And so you'll get upper motor neuron signs, which basically means like stiff muscles. If his lesion is thoracic, then the front legs are normal. If his lesion is cervical or from in this area, then these are going to be weak or lower motor neuron. Because the lesion is actually affecting the pathway here. So for me, you've got the forebrain is super important. You're so cute. Sorry. Poor Sausage, you're so good. Yeah. And then you have the brain stem right behind that. And then you've got the cervical, thoracic, And then, yeah, you have your front legs, then you've got your thoracic, your lumbar, and then your sacral. And that's kind of, as a GP, that's all I'm looking to figure out. That's it. So I just need to figure out which category is he. So when we did our walking back and forth, when I was talking about, you know, is he normal? Does he know where he is? Does he have Alzheimer's? Like, does he go outside and just wander and he never did that before?
Yeah, just to localize whether it's in the rain or whether it's somewhere else.
Exactly. So if he had if Sausage was like, all of a sudden going outside and wandering and like never did that before, and he saw Anna and he growled, and then he saw like he did strange things, where would that fit? Which part of the brain is in charge?
Forebrain.
Yeah,
This is the thinking
totes.
part.
So yeah, that's perfect. So mentation differences, so differences in your personality, those are going to be forebrain, 100%. If your dog has seizures, where is that?
Seizures.
That's
It's probably
that
that.
is.
No, I wish there was one. That'd be cool.
I probably much. I'm thinking of the what's it called? There's
Nope. It's a trick question.
Coordination
Also
is.
forebrain. So seizures are going to be forebrain. So if your dog is having trouble breathing, it's flat out, it's not moving, like kind of comatose. Where's your lesion? Usually.
Again, not breathing and.
Yeah, so it's kind of just laying out, like not breathing correctly. You know, just lying on the ground. It's not moving. It's not reactive. It could also be forebrain, but a lot of times those are going to be brainstem lesions. And so those two are really important because they're a little bit scarier. So
when you so this part of brains is referred to as coordination. What's the name in English for it?
cerebellum.
Cerebellum.
Yeah, I kind of skipped it. So I wanted to get to it. So cerebellum is kind of your exception. Cerebellum is basically hindered in everybody who drinks too much alcohol. But the way
I know that, yeah.
Yeah, so it's basically when you don't have to think about a movement, you know, the movements you've done your whole life, and that's what like martial arts training is all about, is, you know, getting it into your muscle memory. Your muscle memory is your cerebellum. And when puppies or dogs have a problem with their cerebellum, they can't really figure it out because their forebrain is trying to get their head to the food, but it's not very good at movements. It's not good at smooth movements. So you'll see a puppy, it'll be like, left, right. You know, they can't do it really because a forebrain just can't be precise in its movements. So when the cerebellum is broken, the forebrain is trying to create a movement and it's just always not exactly correct. So it'll always be overstepping on the right and then the left and the right and the left. And that's called intention tremor. So any puppy or cat who has who's going to its bowl and it's just doing this. Whenever it tries to do something really focused, then it's tremoring, and any other time it's not tremoring, that's your cerebellum. So yeah, I kind of skipped that. So. But anyway, so those things are important. The cerebellum, unless it's a tumor or something, usually they're born with it. Like you get cerebellar kitties, it's a virus. They have it, they live their lives, they eat really messily. He looks like Monty when he eats, but otherwise they're fine. But if you've got a lesion in your forebrain or your brainstem is really the worst prognosis. So that's going to be really important as a veterinarian to be like, okay, he has, you know, a brainstem lesion that, you know, you might talk to your owners and be like, this is serious, you know, and your prognosis could be really bad. Epilepsy, of course, is an exception to the forebrain bad stuff, especially if they're kind of 2 to 4 years old, because then it could just be epilepsy and nothing bad. So that's why that's important. So when you're talking to people, you're trying to differentiate the brain from the body. And do you remember something funny about the cervical area? What else that's in charge of? If you have a dog that breaks its neck, not completely, but what's another thing you could see besides loss of movement and coordination?
Depends. I think one thing was this nervous recurrence, is this Horner syndrome, that there's
Totally.
I have it.
Didn't think about that bit. So you have a lesion here in the thoracic limbs. What do you expect to see?
A lesion in meaning
Like a defect,
a defect.
a problem with the nerve.
And in general, or now that you're going to in depth?
What would you see in the forelimbs, the front legs?
It's probably different person, different in gait.
Yeah. What are you gonna see? We talked about it like 10 minutes ago.
You said long, no, short.
Short, nice.
Short
Yeah,
step.
yeah, totally.
One thing could be changes in reflexes. I think.
Yep. Are they gonna be increased or decreased?
I think it could be decreased.
Yep. Perfect. What about your muscle tone?
Decreased.
Yep.
Down, and especially if it has been long-standing injury, it might be the loss of muscle mass too.
Yeah.
So if you see,
Perfect. Perfect. Why don't you take a look at Sausage? Do you think we have decreased muscle mass on his front legs? Go ahead and put your hands on there, both sides. It's hard when the lesion is in the middle, the defect's in the middle, because of course both sides will be decreased. Probably easier for Anna to say, oh, he was like, muck, and now he's like Nana, but. So yeah, you're gonna lose your muscles totally. You're gonna have less muscle tone in general. You're gonna have a short, choppy.
I would say that it's
step.
more on the front because I'm not used to that. You can feel this, in the scapula, the ridge, I don't know, of course, if it applies to all the skinny, skinny dogs that are this greyhound type, but usually, I mean, if it's okay, you cut it. I don't think it's that prominent when you go on the front.
Yeah, sure. I mean, I think it's like borderline. It depends on him. It's nothing like he has muscles. But his lesion is also not, 100%. So.
It's also, I mean, I told you before that when he walks, he sort of like his elbows go outwards.
It's probably because he's weak a little bit.
Yeah.
So his walk has changed. I think in the front he's short, choppy, and I think that's because he's weak and he's just trying to keep his balance.
Yeah.
And that's why he's doing that.
But weak in the terms that he can't hold the weight, like in a normal position? Okay.
Yeah.
Good.
So what if, a lot of dachshunds, for example, wiener dogs, they get lesions here to here. What would you see with that?
Well, usually with them it's probably the hind leg weakness. And
Nope.
Don't you?
Nope. Front legs are going to be normal, and because it's not on top, on top of those back legs. If the problem is here, he's going to be weak, right? But if it's before the back legs, the lesion isn't here. So it's just the communication between brain and nerves that's a problem, not the nerves themselves, so to speak. So if you have a problem here in the chest, then you're going to have an upper motor neuron leg, so really hard muscles, long stride, like he's walking on clouds, and increased reflexes. So all of your dachshunds, Lhasa Apsos, anything long and like chunky, they're all going to have that. So
but what happens in a case, because I've seen dachshunds that just drag their asses around and
that's
it's
what
like
it is.
it's
Yeah, exactly. Well,
that's
because the lesion is much worse than sausage. So their lesion is really sudden. It's a lot worse than sausages, and so they have complete, they're not able to communicate at all. And some of them actually, it goes deeper. It all depends on how deep it is. So you have proprioceptive. And some of those dachshunds are pretty compressed. So they're going to be deep pain negative sometimes. So it's going to go all the way through the brain.
Yeah, so instead of a dog like that, and I assume that most dachshunds, when they get those.
But if you look at them,
they're
going to have their muscles are going to be like this. They're going to be really, really tough. It's going to be like this, their muscles cannot relax. And then their reflexes are going to be really big. They're when you hit their knee reflex, their patella, they're going to go like this, So definitely those guys are almost always, because they're so long and skinny, or long and fat sometimes. And it's just so much pressure on that middle spine area. So what are you going to see if you have a defect lesion in the back legs?
in the back legs, you mean
Up here. The lumbar area. Lovely big one.
weakness.
Yep. What are the front legs going to be like?
Front legs?
Mm-hmm.
You mentioned before.
It's a trick question. They're going to be normal. The front legs will be normal if you have something here. So, okay, cool. So what are your reflexes if you have a problem in this back area?
In the back area.
Dilemma sequel.
I think there is. I don't remember the names. Sorry.
No,
The named areas you check was here, and on the patella.
so your reflexes will all be decreased.
Oh, okay. In that sense. Okay, sorry.
No, you're fine. No, I'm fine explaining quickly. So let's go back to reflexes now that we've covered the basics. I can show you the reflexes really quick, but they're crap, like these reflexes. Even if they're not there, it doesn't mean they're working.
So because it's really important for the dog to be totally relaxed when you do the neuro exam.
Well, you can also feel it. But like I said, if they're not there, it doesn't tell you anything. So his reflex was there, pulling back, but it's weak. Which doesn't surprise me. So, and then you can do the back leg. You can pull a little bit. It's even weaker though. And this is going to be your really only reliable
This one?
reflex. And that's too much. I know. It sucks because you have to do a lot of normals. But he's got an overreactive back leg there. So, okay, that's it.
Do you check only on one side, or
No, I would do both sides, but for the purpose of teaching. How does your bladder change, your bladder function, depending on how your lesion is?
Meaning.
So if I have a lesion in my neck, how does my bladder?
How bad the lesion is.
Like how would it change?
Which
Would my bladder be normal?
probably not.
Nah. So whenever you have, basically up until here, you're having, up until the retractable area, you're having an upper motor neuron bladder. Do you remember what that means?
Upper neuron was
Upper motor neuron bladder. It basically means that it's really hard for them to release their urine. And a lot of times, like, it'll fill up. Like, a lot of upper motor neuron bladders have to be, you have to do it yourself as an owner or as a doctor every day. You have to express their bladder for them. If it's really bad, like the dachshunds. Obviously, he's not having issues right now, so he's not one of those kids, thank God. But that happens, and if it fills up, like, long term and they're not able to express it, it actually does quite a bit of damage to the bladder, and it won't be able to express later. And then what if your lesion is here? How would the bladder be? Yeah, so the bladder's going to drip, 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 drip. It's never going to fill up.
So up here.
It's going to be like an open tube.
Yeah.
Yeah. And then so the same for the feces, same rule. And then also if your tail's not working. So that's why at the very beginning we were making sure that he had a tail wag. And yeah, so you can also go here and then, pinch and use his sphincter. Yeah. Okay. That's part of it then.
And then I wanted to ask you, for instance, if you have a lesion here, could it also affect the muscle tone down?
Yeah. I don't think I would be able to tell, honestly, especially on a patient that I didn't know if I'm your
Yeah,
so yeah, and you can see, like, how is he standing right now? This is like classic. He has no clue where his legs are. He's just putting them out there and hoping he stays up, like this is how a horse stands when he's on halfway anesthesia, So what you need to do is just like anything, you need to create a system, stick to your system, and always do it that way, especially with neuro exams because you are going to do them once every 3 months.
But for instance, when you do those postural reactions, these to chest proprioception, how many times do you repeat this one?
Well, if he does it well, then I'm good. You can do it a couple times. If he's doing it bad, then you have to repeat it. And that's what I was going to say. So the reason that we're checking this over and over and over, like I can basically diagnose his lesion by looking at him, just on his walk. But the reason I go further is because medicine is never 100%. And like even if you have, I've had dogs with a defect, and either they're trained that they can't flip their foot over until mama says it's okay, or they just don't care where their feet are, but they don't actually have an issue. So that's why you have to do all of these tests, even though reflexes aren't 100%, postural isn't 100%, the pain, of course, isn't 100%, the pedicula is not 100%. And then, you know, like him crying out with the neck, he didn't do that last time, he did it this time, and sometimes he's just pissed because I did that, and he just wants to cry. It doesn't mean all the time that he has pain. So that's why you have to do the entire exam and then make a check mark in your head, okay, this. And when you get 3 things, you know, or a couple things in one area, then you say, I think my lesion is here. So I think my problem is, you know, wherever you think it is for the
I've
dog.
also read that you do these, you know, you check each place, like when he's lifted up, when you see how his place is, and also this like putting them
Yeah, you can
over
do that
and
too,
then
sure.
see and see if he's. And this was still about the proprioception when you cross the legs, or.
Yep, that's still proprioception. So, but he can fix that.